48 years old. That's when the average American physician is now walking away from medicine. Not retiring, not slowing down, walking away. 9 years before they should. 9 years before the system expected them to. 9 years of patients that won't be seen, diagnoses that won't be made, surgeries that won't happen. And the number one reason they give when you ask them why? Paperwork. Not the hours, not the pay, it's still the paperwork. Think about that the next time you can't get an appointment. This is the Doc Buddy Journal. I'm your host, Eric. Let's go. Hello and welcome to the Doc Buddy Journal. Once again, I'm your host, Eric. So glad that you're here. This is the show where we cut through the noise and talk directly about what's happening to medicine in America. Today, we're going to talk about something that should be on the front page of every newspaper in this country, but isn't, because it doesn't fit a convenient narrative and because the people who could fix it benefit, in the short term at least, from pretending it isn't happening. Here's the story. The American Medical Association, and not some fringe think tank, this is the AMA, just published a study, and what it found should stop you cold. The average age at which American physicians are now leaving clinical practice, that's 48 years old. 48. That's 9 years earlier than the same cohort measured back in 2008. 9 entire years. Think about what that means. We're not talking about doctors retiring at 65 after a full career. We're talking about physicians, people who spent a decade in training, who took on hundreds of thousands of dollars in debt, who dedicated their lives to this, walking out the door at 48. And they're not going to a competitor. They're not going to a different hospital. They're leaving medicine entirely. Now, I want you to sit with that for a second, because the question you have to ask is why? What is so broken? What is so intolerable that a person who spent their 30s becoming a doctor decides at 48 that it's over? Well, the AMA asked them. They surveyed over 500 physicians who had already left clinical practice, and the top answer, cited by nearly 45% of them, was administrative burden. Not the hours, not the pay, not the patients, the paperwork, the clicking, the documenting, the prior auths, the endless soul-crushing bureaucratic machinery that has been layered on top of the actual practice of medicine over the past 20 years. The second answer? Nearly as many, 44.5%, said the work had simply become too stressful. So let me translate that for you. The system had ground them down to the point where they couldn't take it anymore. Now, I want to give you some context because I think without context, these numbers sound bad but abstract. So let's make them concrete. The federal government, specifically the HRSA, and that's the Health Resources and Services Administration, has modeled physician workforce supply out to the year 2038. And what they found is a projected shortage of over 141,000 full-time equivalent physicians. This is across 35 specialties that they modeled, and only 5 are expected to have a surplus. The other 30, shortage, some of them severe. Vascular surgery is projected to have only 66% of the physicians it needs. Ophthalmology, 72%. Thoracic surgery, 73%. Family medicine, which is the backbone of primary care in this country, will have only 76% of what it needs. And here's where it gets particularly troubling. The specialties already hemorrhaging doctors the fastest, which is psychiatry, primary care, OBGYN, these are the ones also projected to face the steepest shortages. A 2025 study published in the Annals of Internal Medicine tracked nearly 72,000 physicians over several years and found that attrition rates were growing fastest in exactly those fields. The doctors who care for pregnant women, the doctors who treat mental illness, the doctors who are your first call when something goes wrong, those are the ones leaving. And by the way, a separate HRSA analysis projected a shortage of nearly 37,000 adult psychiatrists by 2038, with supply meeting only 50% of projected demand. Half. In the middle of what everyone agrees is a mental health crisis in this country. You want to know what that looks like in practice? It looks like a 6-month wait to see a psychiatrist. It looks like emergency rooms backed up with mental health patients who have nowhere else to go. It looks like pregnant women in rural counties who can't find an OB/GYN within 50 miles. This is not a distant problem, it's already here, and we're making it worse systematically every single day. Now, what does the healthcare establishment say about all this? Well, they'll tell you they're focused on physician satisfaction. They'll show you survey scores. They'll tell you about their wellness programs and their resilience training. And here's what I want to say about that. Satisfaction surveys are a lagging indicator. By the time a doctor rates themselves as dissatisfied, they may already be mentally out the door. The people running these health systems have been measuring feelings when they should have been measuring behavior. And the behavior is telling you something that the feelings surveys are not. 59% of physicians leave their first job within 3 years. Let that one sink in for a moment. Hospital administrators expected those same physicians to stay for 6 years or more, and almost nobody predicted the actual turnover rate. There is complete disconnect between what leaders believe is happening inside their organizations and what is actually happening. And when those physicians were asked why they left their first job, the number one reason, cited by 45% of them, was leadership and administration. Not compensation, not call schedule, the boss, the culture, the way decisions were made and communicated, or weren't. Gallup published research that's now being cited by health system CEOs across the country. It says 1 in 2 employees have left a job to get away from a manager, and the leaders account for 70% of the variance in physician and provider engagement. 70%. So you can throw all the money you want at recruitment bonuses and signing packages. If the people running the show don't know how to lead, you're filling a leaking bucket. So what do we actually do about this? Because I want to give you more than a diagnosis. I want to talk about what the evidence says actually works. One of the most honest voices I've come across on this topic is Dr. Patsy McNeil. She is the Chief Medical Officer at Adventist Healthcare. And she says the compensation race is over, done. Health systems that are still trying to outbid each other for doctors are wasting money they don't have on a strategy that doesn't work. What does work, she says, is removing friction. She actually has a name for it. She calls it GROSS, and that's an acronym for getting rid of stupid stuff. And that's great. It's honest. Because the truth is that so much of what has made medicine miserable isn't some grand structural inevitability. It's accumulated institutional stupidity. It's workflows that were designed in the 90s and never updated. It's documentation requirements that made sense to a compliance department and made no sense to anyone actually using them. And the financial case for fixing it is not small. Dr. McNeil's data suggests that highly engaged physicians generate over $450,000 in additional patient revenue per physician per year. This is not an HR issue, this is a margin issue. If you're a health system CFO or a practice administrator, those numbers ought to get your attention. And there's another intervention that's showing real results, and it connects directly to what we do at DocBuddy, so I'll be transparent about that, but ambient AI documentation tools. So this is technology that listens to a patient encounter and handles the documentation in the background. These are showing up in the data as a genuine intervention against burnout. Advent Health deployed ambient AI tools to nearly 2,000 physicians and advanced practice providers. 86% of these users reported less burnout. 80% reported a better patient experience. Stanford Health reported that after less than a year of ambient AI use, 88% of clinicians said it reduced burnout or fatigue. Think about what's happening there. The number one reason physicians said they left clinical practice was administrative burnout. And here is a technology that demonstrably reduces administrative burden, not by making physicians faster at clicking through an EHR, but by removing the clicking entirely, by giving doctors back the cognitive space to actually be present with their patients. And this isn't science fiction. It's deployed today at scale, and it's working. And forgive me here, if you're interested in learning more about our AI ambient solution, head over to docbuddy.com. We call it AI Notes. I'd be happy to talk to you about it, show it to you. You'll be able to pressure test it yourself. So coming back to the topic here, the real question is why more organizations aren't moving faster. And the answer is probably that the people making these decisions have never spent a 12-hour shift trying to document 40 patients in a system that was designed to bill correctly, not actually help anyone. All right, here's where I want to land. We have a physician shortage that is going to get dramatically worse over the next 12 years. We have a documented pattern of physicians leaving the profession 9 years before they should, driven primarily by administrative burden and the sense that the institutions they work for don't respect their time or their judgment. We have solid research showing that the solutions are not mysterious. Engage physicians in decisions, remove bureaucratic friction, give leaders the skills to lead, and deploy technology that gives time back. Gives more time for life, maybe. You are listening to the Doc Buddy Journal. And yet the dominant approach in too many organizations is still to measure satisfaction after the damage is done, run a few wellness programs, and compete on compensation while ignoring everything else. The health systems that crack this, that actually build cultures where physicians want to stay, that deploy tech that makes the work sustainable, that holds their leaders accountable for engagement the way they hold them accountable for financial metrics, those organizations are going to have a significant structural advantage over the next decade because they will have doctors. And the ones that don't get serious about this problem, they won't. And at Doc Buddy, this is precisely the problem we're built to solve. We believe that when you give physicians better tools, better workflows, and less bureaucratic noise, you get better doctors, better patient outcomes, better organizations. And that's not a marketing slogan. That's what our data says. So if you're a practice leader, a health system executive, or a physician who recognizes the problems we've been talking about today, come take a look at Doc Buddy and see what we can do for your organization. Whether you're a physician practice, a surgery center, or anybody in between, take a look at docbuddy.com. And I'd invite everyone listening to take this seriously. We've been shouting it from the rooftops for a couple of years now because the physicians we're losing right now, they're not coming back. And the patients who will need them in 5 years and 10 years, they don't know yet what they're going to be missing. All right, that's this week's Doc Buddy Journal. Thank you so much for listening. We'll see you next time. And until then, be sure you're subscribed on Apple Podcasts, Spotify, and YouTube. And of course, you can always get the newest episodes of the show on docbuddy.com. I'm your host, Erik. Thanks again. We'll talk soon.